Yes, sir. Go to slideshow mode, sir.
Okay, I'm visual.
Perfect, sir. Perfect.
Okay, start कर दीजिए.
Okay, 5, 4, 3, 2, 1. We are live now. We can.
Namaskar. Evening. Today we have taken a very hot topic and need of the hours. On the behalf of the North Delhi Physician Forum, in association with the Delhi Gynae Forum Northwest. So I request our program director, Dr. Praveen Bhatia. Dr. Praveen Bhatia is a senior consultant physician in internal medicine and medical director of the Bhatia Hospital. Only worked at Gangaram Hospital and Dr. RML Hospital, worked as a research fellow with the ICMR, membership in the MIA and MACP, FACE, MAPI, and Jocelyn. He attended various domestic as well as the international conferences, both as a delegate and the faculty. He delivered various public and the CME lectures, and he was past executive and honorary general secretary of the DNZ IMA. Presently, he is an executive member of the North Delhi Physician Forum. Presently, he is running on nursing home at Bhatia Hospital, Main GT Canal Road, Delhi. Now I request Dr. Bhatia for the further proceeding. Dr. Bhatia, please.
Thank you, Dr. Chabra, for the kind words. Very good evening, friends. We all are really feeling very honored to have it on such a hot topic by combined discussion with the gynecologist and physician and all the pathologists and radiologists. Friends, as you are very well aware, that in today's modern era, we are using so many advanced techniques in the radiology, like CT, MRI, X-ray, and ultrasound, for diagnosis, accurate diagnosis, and proper management. But along with this, one destructive, or I should say negative aspect of this is that some persons have been using it, misusing it rather, for sex determination purposes, which we all doctors definitely condemn for this. And because of this misuse of the ultrasound diagnostic tool, there is significant alteration has been seen in the female and male ratio, males being comparatively lesser than females. But the latest report in 2021, it has shown the ratio is gradually improving since the PNDT Act came into force in 1994. Before that, significant female foeticide was there, and this ratio was getting altered. So in future also, we have to be very, very careful that this particular technique should not be used for sex determination point of view, so that we can use it properly, purely for diagnosis and the proper management of the patient. This is, friends, this is the need of the hour, definitely. And on this screen today, I am feeling honored to have all the ophthalmologists, all the physicians, all the gynecologists, and so many other specialized areas of the medicine, which will require all the techniques of the radiology, especially ultrasound, for our accurate diagnosis and proper management of the patient. We should be in the position to use it very fearlessly, and we should be very handy with the ultrasound machines. And if required, if patient is serious, we should be in the position to use it bedside also. So, dear friends, we are together here on the screen just to acknowledge, so in what possible ways we can use it for our routine day-to-day clinical works. And through this, I would like to convey my message to the authorities and to the government. How can we achieve the maximum benefits from the ultrasound, from regarding the newer emerging techniques, so that we can use it very safely and legally safely also. So I really feeling honored to welcome on the screen North Delhi Physician Forum and Delhi Gynae Forum Northwest branch and all the radiologists too. So first of all, I would like to invite Dr. A.K. Malhotra on the screen. Dr. A.K. Malhotra is a very senior consultant and very well-known figure, and is a friend of everyone, such a social personality. And I would request Dr. A.K. Malhotra to be on the screen for the opening remarks. Dr. A.K. Malhotra, please.
Thank you, Dr. Bhatia. And on behalf of North Delhi Physician Forum and Delhi Gynae Forum Northwest, I welcome all the dignitaries present today on this very important topic, which is in one hand is the diagnostic techniques are definitely required just to diagnose the congenital anomalies. But on the other hand, the misuse happening in the society is also very rampant. But females are really very important part of the society, and how to stop female feticide is the today's topic. I welcome our Justice, Dr. Anil Dave, Dr. Professor Rajiv Sood, Dr. Abha Sood, Dr. Praveen Bhatia, Dr. Chabda, the mentor of this program, Dr. Shalini, Dr. Sushila, Dr. Gaurav Agarwal, Dr. Rajiv Gupta, Dr. Sandeep Miglani, Dr. Bahar Kaul, Dr. Kiran, Dr. P.K. Goyal, Dr. Jha. And I must give you one information in the just in the beginning, that I am blessed with a granddaughter last Sunday only.
Congratulations.
Thank you. And I cannot express my feelings. मेरे ख्याल से शायद ग्रैंडसन होता तो मैं इतना खुश ना होता जितना ग्रैंड डॉटर पे मैं खुश हूँ.
चलो बधाइयाँ दादाजी को.
थैंक यू जी. और पेरेंट्स का भी वही हाल है. तो वी मस्ट give awareness in the society. Of course, today's topic is very important, and I now further hand over proceedings to Dr. Bhatia.
And very heartily congratulations from all of us. Very heartily congratulations.
Thank you, everybody. Thank you, everybody. Thank you.
Next, very important captain of the ship, who is a very important guiding force, Dr. Abha Sood, who is from the Delhi Nursing Home Forum side. Dr. Abha Sood from Gynae and gynecologist and obstetrician. He is head of department of the Obs and Gynae in Jaipur Gordon Hospital and president of the DGF Northwest. I would like Dr. Abha Sood to invite on the screen for the opening remarks. Dr. Abha Sood, please. Dr. Abha Sood.
Yes. So thank you very much, Dr. A.K. Malhotra. I am really grateful to New Delhi Gynae Forum and its office bearers, and especially to Dr. R.M. Chabda for giving me this opportunity to be a part of today's discussion. The topic, as already mentioned, is legal implications of antenatal sex determination, ultrasonologist and couple perspective, and theme is how to prevent fetal sex determination. Regulation, the whole ambit comes under PCPNDT Act 1994 that regulates and prevents its misuse. It was commenced on 1st January 96 and later amended, and new rules came into force from April 2003. I am a gynecologist and happy that there are few more from my community in the panel who are primary physicians in such cases. The radiologist will deal with the issues they face after the fetal anatomical sex is determinable. I will deviate a bit and talk about PC part, that is preconceptional and early pregnancy, when anatomical sex by ultrasound is indeterminable, but still we have to fill and obey all the PCPNDT formalities. So I will mention a few real clinical situations. Take the case of follicular monitoring by ultrasonography, which is a part of infertility investigations only. No gametes are formed as yet, so sex is not there. But from form F has to be filled, and a consent is taken from the patient that the sex of the embryo or fetus will not be disclosed. Now, when there are no gametes, how the sex can be told to her? So that's a big question mark, and it sometimes, puts it in the soup. And then after filling the form F, the various technicalities and the procedures which are involved in the PCPNDT Act starts on. So that is there when there are no gametes. Then take the case of ectopic pregnancy, which is a life-threatening emergency. And ultrasonography is a vital diagnostic tool no anatomical sex of the embryo can be determined at this stage. Still, Form F under PCPNDT Act has to be filled. And it does not stop here. When patient comes for post-op follow-up and is recovered, she is keen to know, not only she, the relatives also want to know the sex of the abortus. So see our situation, how we have to answer them and face them. Similarly, the cases of early missed abortions, etc. And now the discussion is on that as gynecologists, if we counsel a couple for infertility, they have yet to conceive, or a couple comes to us before conception for counseling as there is a genetically affected child in the family, the clinic will be called a genetic clinic and it will come under the purview of PCPNDT Act. And again, the same formality, the conception has still to occur. So that is the situation which I am worried about. And may I mention here, such advice is taken from us not only at clinics, also at social gatherings, in gyms, during morning walks, anywhere. So all they are for genetic clinics for us, you mean? So a serious thought has to go for the implementation of PCPNDT Act in such situations. So at the end, I may mention that according to Economic Survey of 2022, All India sex ratio is now 1020 to 1000 males, which is a positive shift. But still in northern states, it's still 938, 968, 966, 970 in one of the prominent states, as compared to southern states, where it is 1084, 1037, 996, etc. So there are many other aspects which have to be looked into apart from PCPNDT Act to prevent female foeticide. So that's all I want to say. And thank you very much for giving an ear to my views. Thank you very much.
Dr. Ava. Thank you very much for such words you have told that the ratio is now changing. It's sign of positivity. Now, dear friends, in next few minutes, we will go through the very hot discussion with on my panelists. I'm feeling honored that we are having a very eminent and competent radiologist, Dr. Shivani Mehra. She's from Dr. Ramanohar Lohia Hospital and she's professor with Atal Bihari Vajpayee Institute of Science. And next on my panel, welcome Dr. Mehra. Next on my panel is Dr. Sushila Gupta. He's a very competent gynecologist, and definitely we would have the words of wisdom from him. Welcome, Dr. Sushila Gupta. And next is Justice Anil R. Dave. We are feeling really, all of us are feeling honored to have you on the screen, sir, Justice Anil R. Dave. And it is for the very first time that we are having judge in our meeting. You are retired judge from the Supreme Court, and presently also you are doing a lot of social work, and we all are impressed with your words of wisdom. Thank you very much. Welcome, Dr. Justice Dave. And next is Dr. Gaurav Agarwal. He is a very diligent personality with double perspective, overlapping perspective of legal and medicine both. Welcome, Dr. Gaurav Agarwal. We take 2 minutes. We'll have a few questions from you too. Welcome, Dr. Gaurav Agarwal. And we have got coordinator, Dr. Rajiv Gupta. He is a senior consultant physician and HOD Department of Medicine with the Birla Medical Institute, Punjab. Dr. Rajiv Gupta is a very competent physician and senior consultant. Welcome, Dr. Rajiv. And next is Dr. Sandeep Miglani, who is ex-additional director of the Delhi Government Health Services and had been medical superintendent of the Joshi Hospital and City of Delhi. Welcome, Dr. Sandeep Miglani. And we are feeling honored to have two guests from Rajasthan, Dr. Rajshekhar Yadav. Dr. Rajshekhar Yadav is a social activist. He's not only a doctor, basically he's doing a lot of positive works for the medical community and the medical families. He's a blog writer and he's doing a very positive work for all of us. Welcome, Dr. Rajshekhar on the screen. And very next is Dr. Meenakshi Sharma, very clear in her mind, very much clear. She's a senior gynecologist. And welcome, Dr. Meenakshi. And our task will never be complete without Dr. P.K. Goyal, who is definitely and Dr. Pawan Kumar Goyal is an executive member of the North Delhi Physician Forum, senior consultant physician. Next on our panel is very energetic, very enthusiastic, Dr. Kiran Chabda. She's senior gynecologist, and we will definitely in next few minutes listen your perspective on the PNDT Act and how we can have a better knowledge. And next on my panel is Dr. Behar Kohli Sahani. She's basically a very young gynecologist and dealing with the high risk pregnancy, gyneendoscopy, and oncogynecology. And very next person, I think Dr. R.M. Chavda definitely doesn't require any introduction. He has got a very energetic, very enthusiastic, and the special zing which he has got for all these activities. And besides being a consultant, besides being a very good doctor, he is also busy with a great future for the medical community and our medical family. He is governing member of the API of India, and basically he is a founder member, he's a founder of this North Delhi Physician Forum and had been the past president of the NDPF too. And he has got so many awards and so many affiliations to his name as is listed on the list. I would request Dr. Vedant Chavda to enlighten on the topic. Dr. Chavda, welcome on the stage. Dr. Chavda.
Thank you very much for Dr. Bhatia for the kind words. First of all, I would like to thank you, North Delhi Physician Forum and Delhi Gynecologist Forum, Northwest, for giving this opportunity. First of all, at the outset, I would like to thank you, my father and preacher, who taught me to unite the people and guided me to achieve this position. Late Shri Jagdish Chandra Chavda and late R.K. Mitrka, he was the renowned surgeon. They left family about, I miss them always. So disclaimer, this panel discussion is actually for the education and the motivational purposes. There is no conflict of interest or any intention to hurt anyone in person, ethnicity, government, media, association of the organization. So dear friend, imaging technique in the advanced and the modern era, imaging technique, radiology, ultrasound, CT scan, PET play a significant role in the accuracy in the diagnosis and the treatment of the diseases and has completely changed the scenario in the management of the disease. In all the specialty, cardiology, radiology, physician, gynecology, all the modalities change the scenario totally. On the other hand, sex determination plays a role of the virus to corrupt the system in using these imaging techniques in the diagnosis and the treatment of the disease. This is a big problem. Sex determination is just like a virus. To remove this virus, we require the PNDT Act is required. So due to the PNDT Act, we are unable to use these modalities freely and are restricted to many limitations to achieve the maximum benefit in the diagnosis and treatment of the disease. So to clean this virus, we require law and ethics in the form of the PNDT. So law and ethics are just opposite, ethical and the legals. So as per law and ethics, we are always which is right, which is wrong. So the ethics is a set of the moral principles and the code of the behavior that govern an individual's action with the other individuals and within the society. What is the law? Laws are the societal rules and regulations that are obligated to observe. So law have governed the practice of the medicine for over the hundreds of the years. You see, combination of the law and ethics is that there is a National Medical Commission, that is Medical Council of India, and the other states of medical councils. So there are list of the law and laws. See, there are 72 laws. Today we will discuss the PNDT Act that started in the 1996, as Dr. Abbasud was telling us. So there are 72 rules and regulations. What will the impact of these rules and regulations? That creates the Babu Raj. If there are more laws and regulations, that creates the Babu Raj. And ultimately all bred the either corruption or the violence. So always a sword hanging on the doctors. So Justice B. Basant Kochi written under how can a medical fraternity, especially the doctors, work under the regulation or the over-regulation, plethora of the law and regulation, 72 laws. It remains always questionable. So bureaucrats and the politicians have made all the doctors overloaded. You see this picture. The politician and the IAS officer, bureaucrat, they put all the load on the doctors. So in spite of facing so many violence and other things, still doctors are morally duty bound and the COVID virus in the US in the corona pandemic. What a great picture, which shows how a doctor is trying to save the life by not caring about his life. Salute to that painter. So in spite of that, there are more than 2,500 doctors COVID martyr. So what is the impact of the exploitation and the extortion and the blackmailing on the doctor? Broken relationship. They will doctors are abused to the alcohol or the other drugs abuse. They will go into depression. You have seen the recent example, late Dr. Archana, she committed suicide. So ultimately, there is a decreased quality of the care and the increase the medical error, decrease the patient satisfaction, and decrease the productivity and the profession efforts. So, and you see the recent example in the Rajasthan, Mahila Chikitsak, injured herself due to the blackmail and the arop, due to the blackmailing of the exploitation. So, dear friend, one question to Dr. Sabina Mehra, being a senior doctor in the Department of the Imaging and the Radiology, along with the president of the IRIA, what are the issues and the problem you are facing to use it freely and hassle-free legal point of view? And another question, what are your thoughts and suggestions and the advice to the young brigade to practice freely, fearlessly and the hassle-free? Dr. Sabina, please.
Very good evening to everyone. The medical dignitaries and also the legal luminary in this meeting. I'll apologize first for the background noise that you can hear. I'm at a family function, but this topic is of utmost importance and needs to be discussed, so I did not excuse myself. So, as you know, ultrasound is actually a wonderful tool for monitoring the fetal well-being, for monitoring the fetal growth, and for detection of fetal anomalies. It is almost like having eyes inside the womb and seeing whatever is going on inside the body. The purpose of ultrasound never was sex determination. It never should be sex determination. That is a flaw in our society that led to it becoming a tool for sex determination. We see in the West, people are, parents are so keen to know the sex of the child for other purposes. They want to know the sex so that they can decorate the room, they can plan the everything else, the wardrobe and things. But in India, the social scene is such that it became a bad tool in the hands of certain bad sheep in our profession. It is never to be used for sex determination. More than the legal implication, it is the moral implication of sex determination, which all the radiologists are against. And it is a shame that PNDT Act had to come in order to rope in those certain black sheep who were actually indulging in these activities. But by and large, as was pointed out by my gynecologist friend, much has changed. Also, because of the PNDT Act, much has changed in the past few decades, and people have become doctors, sonologists have become much more conscientious, and it is the duty of every radiologist to understand that we have to use this only for the purpose of detection of anomalies and fetal growth and development. As long as we are doing that, as long as we are asked to do that, we are in the right. And it's our moral obligation to do just that. Some people feel that the law has become draconian. I still don't feel so. Yes, as far as the follicular monitoring and filling of Form F for ectopic pregnancy goes, that certainly is out of place. As was very rightly pointed out, that is the preconception stage. There is no way you can detect the sex of the fetus at that stage. So that is a bit preposterous. That is taking it a bit too far. But by and large, we all need to act responsibly. And I am proud to say that at least 99% of the radiologists do act responsibly. Now, if you bring in people, if the government trains people as sonologists, and some of them are medical doctors, some of them are not even medical doctors, that practice we are against. So if that is being done, then how can you control who is doing what? So it's very important that turf erosion shouldn't happen. Radiology should be only the forte of radiologists. And it is the responsibility of all of us radiologists to be very ethical in doing ultrasounds only for antenatal fetal well-being.
Thank you, Dr. Shivani. Now, my next question to Dr. Srila Gupta. Because this modality is related to you, gynecologist. Being a senior gynecologist, what are the problems and issue for using these modalities in the providing the service to your patients? What are the proposed remedy to improve its utilization in the diagnosis and the treatment in the gynae patient? Dr. Srila Gupta, please.
Good evening, everybody. Thank you, Dr. Chabra and Dr. Bhatia for inviting me and giving me such an honor. And as far as this modality is concerned, as Dr. Shivani already said, this is everybody's thinking this is actually a very good modalities, but we are not able to use it properly. That is also true somewhere, not exactly. If I say whosoever is settled and doing practice for the last so many years and using ultrasound machine for so many years, then there is not much hassles except having a written work, more of a written work, clerical work, and time consuming has become. And the newer and newer applications are increasing day by day. Like as follicular monitoring, previously it was not included. Still, we are not sure whether patient, we are telling that patient is preconception. We are not sure whether she is going to conceive or not, even whether she will conceive or not. And beforehand, and patient becomes so hopeful. आप उनसे फॉर्म भरवा रहे हैं, they become so hopeful कि अच्छा कंसीव करने वाले हैं. तो follicular monitoring is definitely somewhere we are not able to justify. Their F form should be filled, and this is the problem. But if somebody is coming new in this practice and want to buy machine, then they feel there are lots of hassles. Although they are not hassles, they are some time consuming. Like if you are planning to buy machine, you have to register your machine beforehand, you have to inform them, you have to register the place, and you have to not only register, you have to inform them before 1 month. And when your place is ready, you have to again inform them for inspection, and then they will come. Not only this, you have to have bigger infrastructure, like you have to have separate room for the ultrasound machine, and GC separate room for GCC. Like Dr. Abbas who said ki every gynecologist should have GCC clinic registered as a GCC. So you have to have bigger space and infrastructure. Then this is again a monetary burden to the doctor, and this monetary burden will go again to the patient only, because this modality will become expensive if you are. And not only this, it takes minimum 2 to 3 months. If you start using ultrasound machine, it will take few months, 2 to 3 months to 6 months to start your practice. But at the same time, the law is working definitely. Like Abbas who said, there is a changes in the sex ratio, so there need to be law. But the main problem is media is not that much aware, like public is not aware. There is a scarcity and scare among the doctors. Everybody is scared. Like PCPNDT act, that sometimes they take it as a draconian. But आम public अभी भी demand करती है. They do not feel that they are also, if they are asking, they are also punishable. Public doesn't understand. Although public is also punishable, the law says public is also punishable if they demand. But at the same time, public में कभी कहीं ऐसा news नहीं आया कि any couple has been arrested for asking sex determination, and still people are happy having a male baby in spite of female. Although Dr. Malhotra has said definitely we are changing and we are happy with having a girl child in our family, that is a different altogether scenario. So public society has to be changed. There is a lot of changes should be started in the society. So their demand, we should work on the demand level also. And if society is not going to change, the female female perspective is not going to change. Female atmosphere for the female is not very good. Then we have to, law should be implicated forcefully on the public also, similar forcefully as on the doctor. This part, and we should encourage our newer and newer doctors to come up with the ultrasound machine, and they should be doing ultrasound. They should not be scared of this. Like more and more people, if they are using, like just a ultrasonologist, no ultrasonologist has stopped working, but gynecologists have stopped using ultrasound machine because of the scare. We should now encourage them. More and more people should use, so more and more doctors are using this machine, and more voice we are having, and more data we can collect, keep what way we should move. So this is also very important. Newer doctors, they are discouraged by the senior also sometime, and they say that there are so many hassles. There are hassles, they are a problem, but they are time consuming. As I am using ultrasound machine as a gynecologist for the last 30 years, I know there is a problem. There is this change, like before 30 years and now there is a definitely change. We have to, but we have to follow the rules. If you are doing everything according to them, then there is doing ultrasound is not a problem as such. Definitely written work has increased, and you have to have employ one digitally skilled person. Alone doctors cannot do all the work, written work. And so again, you are having more human resources. Again, the cost is going to be up because of the infrastructure and because of the human resources. If
Okay.
single doctor is doing ultrasound, like single-handedly, small nursing home we used to do, if I am the clinician only, I am doing radiology also, and for that matter, if there is urgency like ectopic pregnancy and all, if I have to rush to the OT also, then it becomes very difficult to do all the work, do all the F form and all. You have to have proper infrastructure, proper human resources, only then you can do. So the cost is definitely is going to increase for this mortality.
Yes, right. Dr. Sheila, you rightly said, even if you want to change the place of the keeping the machine, then you have to inform the authority.
Yes, I have changed the place, and this change of place is also temporary, but I could do it. It took 2 months, 20 days almost, but I could do it, and I am doing ultrasound. That's the scenario. It takes time, but everything is being done. That is,
Okay.
if you are doing everything, the time will take, and definitely you have to have more infrastructure, you have to have more human resources, but the things are being done. And definitely, like this is I think everybody will say कि follicular
Yeah.
monitoring के form, and especially if you want follicular monitoring form, I must say कि there can be single, like one time form. Like if we are doing 5 times 6 times follicular monitoring in one cycle, every time new form has to be generated.
Yeah.
So there is lots of written work.
Okay. Thank you, Dr. Sheila. And next question to Dr. Gaurav Agarwal. Very important question. Leniency versus the strictness of the appropriate authority. So what, Dr. Gaurav, what is the appropriate authority supposed to do if there are technical, formal, or the insignificant lapses in filling up the Form F as required under the PCPNDT Act? Would the license of the doctor to practice be and the clinic sealed in all such cases? Very important question to Dr. Gaurav.
Thank you, sir. Thank you for the opportunity and greetings of the day. So, I think there is a lot of anxiety among, ultrasonologists and, gynecologists as to what would happen. Because Form F still remains a draconian concept, a draconian part, as already highlighted in the entire scenario of PCPNDT Act regulations. So, in this, there is a categorical judgment, and I think Honorable Justice Andave will share his consent with me. In the case of Suomoto versus State of Gujarat 2008, when this question came up in the judgment, and they very clearly answered this question, because before this time, even now, rarely at certain places in the country, there are many, sub-district magistrate, SDM of the area is authorized to inspect or rather seal, other than the appropriate authority being at the district chief medical of CMO's office. So they are authorized to, inspect and seal, and if there are any, problems found, to take action against the said ultrasound clinic. So this question particularly came up in this particular case, that whenever there are some deficiencies in filling up Form F, should doctor be penalized in each and every case? Should their license be suspended? So now we have this, and as rightly pointed out by Dr. Shivani, that now there is not source of insecurity, I would say, among doctors regarding Form F. If you take this judgment in letter and spirit, and you always keep a copy of this judgment, and whenever required, you approach the medical authorities, your appropriate authority, and tell them that minor lapses, insignificant lapses, formal lapses do not make a case for penal action against the doctor, as far as Form F is concerned. And the court has given very clear examples where what is minor and what is major. The court says that major lapses would be: number one, totally ignoring to fill up Form F, taking it casually, or even forgetting to fill it up is also a major lapse. So that is one example. Second is, if you are filling up the Form F, due to whatever reason you are not filling up all the particulars of the pregnant woman. That is second example. Third is, you are filling up particulars which are wrong. For example, you are writing name and address, wife of or whatever, and then mobile number, all these the particulars, Aadhaar number and all. And a good way would be to verify the mobile number then and there. Ask them to make a missed call on the mobile number of the ultrasound clinic. It would, that would still make, as far as possible, भले ही उसका पेशेंट का ना हो, पेशेंट के रिलेटिव का हो जो साथ में आए हैं मोबाइल लेके, कि एक थोड़ा सा ये हो जाए कि हाँ ठीक है, जेन्युइन है. So these are major lapses that the court says. The others are minor clerical errors, should be taken leniently by the appropriate authority. The court goes ahead to mention these very words. So I think this is one aspect. And whenever there is a dispute, you approach the appropriate authority and tell them your end of the story, that this is minor and this happened, this is a clerical error, so it should be taken leniently.
Okay.
This is one aspect. Yeah.
Dr. Gaurav, you mean for the clerical mistake, doctor should not be punished?
Should not be. The law says that doctor should not be punished, and the license to practice, that is the registration under the
yes, this
State
is not
Medical Council, should not be cancelled.
Yes, this
the
is
law
not
is clear about it.
So, next question to our Honorable Justice Anil Ardave. What are your views about the clinical practice and the law? What is the relation? And does the PNDT Act limits the use of the advanced imaging techniques due to the legal point of view? What are your views, sir? It is yours.
Kindly unmute. Justice Dave, kindly unmute.
Very good evening to everybody. As a matter of fact, I have come here as a student. I don't think I can say much to all enlightened doctors, but I may tell you one thing. The intention here was such that you should not abuse the machine and you should not abuse your power so as to find the sex of the fetus. That is the only purpose. Honestly speaking, I'm digressing a little. I think this is more a social problem than the legal problem or medical problem. You see, better course is to teach people, to educate them that, okay, daughter, say, I see so many girls, ladies here. On the contrary, they are very competent. Why do you think that daughter is a liability? The real difficulty is that people feel that the daughter would be a liability. I don't understand why they will be a liability when she can go to Mount Everest, when she can go in the army and she can fight the battle, when she can go. There are 7 girls from Indian Navy, lieutenant to commander. In a sailboat, they went to the entire world. If they can do all these things, I can see so many gynecologists here, so many radiologists here. If the girls, ladies can do so many good things, and how people understand them to be a liability, I don't understand that thing. So they are never liability. And I have seen number of ladies, number of girls who are maintaining the parents. Either they are single child or they are 2 daughters, 2 sisters, and they are looking after the parents very well. And the parents are really very happy. They are really very happy that they say that we don't have daughters, we have got sons. That is what happens. So the best thing is to educate the society. I think if the society is educated, then there would not be such a problem. Secondly, it has been rightly said that you don't do anything to the person who wants to know the sex. As a matter of fact, he can be sent to jail for 3 years. The same provisions apply to both the doctor and the person who asks for sex determination. If I come to you and I say, okay, I would like to know what is the nature of the fetus, whether son or daughter, I am guilty. Then the one who examines, then he will become guilty. But first of all, I would be guilty. It is like a bribe. The moment you offer the bribe, you are guilty. So here, I don't understand why you don't take action. Do doctors start taking action? That here is a person who is asking for this. Do this 3-4 times. Let people know that such things happen, and doctors are conscious about this fact. People will not come to you, and this all happens because of some black sheep in the profession. I mean, I would say that society, if the society is not very good, then people would be everywhere. I mean, this black sheep would be everywhere, whether it is judiciary, teachers, doctors, nurses, everywhere. So we do have some 2, 4, 5% such persons, and they defame the entire profession. Now, coming to the point, I firmly believe that when there is a development, why should we not take due advantage of the development? You see, otherwise, had this video conferencing would not been there, had the computer would not be there, we all would have met at one particular place. Number of persons could not have joined. Somebody from Rajasthan, I don't know, forgot the name. She has come from Rajasthan. I am here in Hoskas and Cleve. Somebody is in Ashok Vihar. Now you see, we have saved so much of time. Why not to use the all these facilities? I remember as a young boy, I know that you know it more. Screening. Screening was a thing which was available. That's all. Either X-ray or screening, and there used to be portable screening machine also. So you go with the screening machine to the patient if the patient is immobile. Now you have got all modern devices. Why should you not use those devices? I firmly believe that you must use it. You must use it. If you don't use it, then what is the use of development? What is the use of development? Right now, we all would have met in one. The only thing is we would have a cup of tea. That is the only loss which we are having. Had Dr. Chabra invited us everywhere, somewhere, then he would have offered us a cup of tea. That is the only loss which we are having right now. Otherwise, you see, we all persons met here. We are doing our work. We are studying seriously, or we are knowing our views. So I think number one, use of all these ultra-modern machines must be done, but very carefully and very cautiously. So far as Form F is concerned, I really believe that if there is any clerical mistake, if there is no malice, the person cannot be punished. No doctor can be punished. You see, whenever there is punishment, then there should be an element of malice. You must have a malified intention. If
So
you
may I
don't have
come
a
in here?
malified intention, you don't commit. Yes, please.
Yeah. Sir, actually, the issue is the appropriate authority. The courts have a lenient view. I understand. I have seen the history. There are many judgments favoring doctors in this sense. But the issue is the appropriate authority. They are being very harsh upon doctors in even the most minor of errors in filling up Form F. So the issue is with the appropriate authority, not with the judiciary as such. So it is how to handle the appropriate authority under the ambit of law.
Then I think Medical Council of India or somebody should go to the
Yes.
government and say that you have some doctors there or have some qualified doctors. You see,
Yeah.
It is
because
the doctors
FIR
who are
cannot be filed
making a
unless there is
nuisance there.
Sorry, please.
It is the doctors who are creating nuisance in the appropriate authority, sir.
But then it is very, very difficult because you see, otherwise he knows
Dr.
very
Gaurav,
well.
we will discuss later on this one.
So there can be jealousy also. What you say is right. I can understand that what might be happening perhaps also. It is possible. But in that case, what is the way out then? Because you see, you have to groom your persons very well. Say, I'm also a chartered accountant. In my chartered accountant, we have got a disciplinary committee. In disciplinary committee, we have got chartered accountants there because we know whether a person, the chartered accountant, has made a mistake in considering this particular entry because we know the accounts. So you are all doctors. You know whether there is a mistake, whether there is a negligence or a mistake. There can be a mistake. Anybody can make a mistake. I just today or yesterday, I told my friend, doctor friend, that suppose if the doctor cannot, I mean, if everybody is safe with the doctor, then no relative of doctor would ever die. That Mrs. Sharma, gynecologist, who poor lady committed suicide. Now, what was her fault? She must have tried her best because every doctor would try to see that the patient, if he is coming weeping, he should go smiling. That should, because if I'm a doctor, I would like to see that my patient gets cured. So you don't have that intention at all. And I believe that majority of the judges understand this thing. Therefore, judges are always very lenient. But of course, the judges and judges, somebody is not having sound common sense, he's not aware of legal position properly, he might make a mistake. But otherwise, such small mistakes would not show that there is any malified intention. but you will have to undergo all this rigmarole of all these things, because appropriate authority, if says that let FIR be filed and FIR is filed, then you are in difficulties. You are definitely in difficulties. You will have to keep your practice aside and you will have to go to court every day. I'm not every day, but every time you will have to go to court. That's a really problemsome. So there is a problem, but you have to see that the appropriate authority behaves well. And if you can't convince your doctors, then it is very difficult. That is what I was thinking, that MCI or some body like your body, you should see something. You should see that some good persons are appointed, those who are having very sound knowledge. Because you see, there is a lot of difference between negligence and mistake. There may be a mistake, honest mistake. I very often say that I'm a Supreme Court judge, but if there is a Supreme Court judge, then 25% of my judgments would be set aside. Supreme Court is not, is final. It is not correct. Supreme Court judge might make a mistake, but it might be an honest mistake. Doctors, there are two possibilities. Sushila ji, kya कहती हैं आप?
Yes, I wanted to say, in medical fraternity, there is lots of diversity. Whosoever is sitting on a different chair and doing different type of work, they cannot analyze the problems related to the clinician. Like whosoever is doing in private practice, they cannot analyze the problem in the government sector. Who is practicing in government sector, they cannot analyze, because the scenario is totally different. And whosoever is in appropriate authority or doctor, they are involved, they are doing different work all together, years together, then they cannot appreciate the problems. This is the problem. Medical
apart from the doctors, there can be different views. There can be different views, different medicines. You as a doctor, you feel that okay, this medicine will be more effective. I have got some different experience. I say no, not X. Let us give Y antibiotic. Am I wrong? Are you wrong? No. Because of my experience, I honestly believe that Y antibiotic would be better because of this facts. You say no, Y is not effective. X is more effective. We both have got sound reasons for this. We both have our experience. Nobody is negligent. Nobody is committing a mistake. But because you go by your experience, I go by my experience. We lawyers, I argue in a particular manner, you argue in a different manner. Our manners may be different. There are some lawyers who would argue the strongest point first. There are some lawyers that believe, no, let us start from a mild point, and thereafter we go at the end, we'll advance the strongest point. No, there's a different method.
A different opinion. Yeah.
So, yes. But what is more important according to is malice, malafide intention. Whether your intention is malafide, otherwise I do feel that in case of emergency, you may not fill the form F also. Suppose the circumstances are such, suppose the patient has come in emergency, in OPD, now are you going to record the statement? Or are you going to treat the patient? Your first duty is to treat the patient, do the formalities subsequently. And if the law says that do formality first, then that law is bad, I would say. Because your first duty is to save the patient. So here also, according to me, when there are minor lapses, is there all clerical work also? Why do you want doctors to do clerical work? I fail to understand that thing. When you have done MBBS, why do you want to become a clerk? Why the government wants you to become a clerk? Whether telephone number is there or not there. How are you concerned? Are you a detective? Suppose somebody is not having mobile. Come on, what would you do? Suppose that person is making a mistake. Honestly speaking, I don't remember my wife's mobile number. I know only my mobile number. Honestly, I do not know. No. Suppose you ask me, I can't. Honestly, I can't say. On by oath, I'm saying I do not know my wife's number. I have to just simply say Meena. Then immediately Meena would come. Then I would telephone her. I say Rajiv Gupta. Then Rajiv Gupta or Dr. Chabra. I do not know his number at all. Rajiv is my good friend since 1979. I know him very well.
Yeah.
As I said, I don't know my wife's number. Then what more can I say then? And I'm very sure some of you must be like that. That you might not be knowing the telephone numbers of your spouse or your children. It happens. So suppose that that person gives you wrong telephone, does it mean that you are at fault? I think doctors must understand, and appropriate authority also must understand this thing. You must make them understand, and you must have some classes for them, I would say.
Okay.
Let there be some classes, something like that, so that they may also know. As a matter of fact, sorry, I'm digressing. I was solicitor to government of Gujarat for 11 years. I was looking after service matters. So far as forest department is concerned, they were committing so many mistakes. So I said, let us have one conference. I delivered a lecture to all IFS officers, forest service officers, and they really liked it. I said, don't commit these mistakes. You are very good officers, but you do not know what law is. Now here you can say that these are the practical difficulties. How do I look at this? How do I fill up the form F? Suppose there is an emergency. Do I fill up the form F, or do I look at the patient? Suppose there is an emergency with portable machine, you have to go somewhere. Now, will you just take permission? Because you see, everywhere you use your ultrasound, there is a place. Now, how do you do that work? You can't do it. It means that you would permit your patient to die. nonsense, I would say. I'm sorry, I'm using harsh word. I'm saying as a citizen. I'm not talking as a judge, but I'm talking as a citizen, an enlightened citizen who knows something. Now, would you like to say, if I were a doctor, I would never think about that. I would first of all take care of my patient, and you are all are supposed to do that thing, and you must be doing that also. So, Dr. Sab, I think Dr. Agarwal, if there are minor mistakes, there are technical mistakes, I don't think any serious view should be taken. It cannot be taken. And even if it is taken, FIR is filed, I am very sure he would get acquitted. But the difficulty is he will have to undergo the entire procedure, which is
So I
very, very
think,
painful.
Yeah.
Very,
I
very
Thank you
think at
very
painful.
this
much.
point of
In the
time,
nutshell, for the minor thing, doctor should not be unless until there is a
Malified intention. Malified intention.
intention.
You look at the intention behind this.
Thank you very much for the kind thoughts and views. And now I will come to Dr. Rajiv Gupta. He is also physician. So physicians are facing so much problem. Dr. Rajiv, being a senior physician, what challenges are you facing to utilize these imaging technique in your day-to-day practice, clinical practice, like ultrasound guided pleural fusion, aspiration? What are your views about these things? Dr.
Well, thank you, Dr. Chabra. And I heard the luminaries here, and I, in fact, just before this answer, I would like to agree completely with Dr. Mr. Anil Dave. See, despite this law being there for such a long time, we were unable to change the sex ratio favorably even today in the North India. See, same law applies to North and South India. Why the South India is doing better than North India as far as sex ratio is concerned? This is very clear. You sort of encourage, you reinforce the female sex, make them better educated, better economically, stable, and see the results. Now the entire problem is societal problem. It is something is wrong with society, not with the doctors, not with others. It's society side. They have a society that, but I don't think law is fulfilling its purpose. I hardly this law practice in Europe or in why is that people change. Not just people.
Rajiv, you are not clear.
Dr. Rajiv, you are not clear.
Network.
Dr. Rajiv,
Am I audible now? Hello.
Audible, Rajiv. Dr. Rajiv.
Now? Hello.
Yeah.
Yes, carry on, please.
Okay. Now, regarding my use of ultrasound practice, it was so easy to do ultrasound guided aspiration bedside. It would have taken me only 5 minutes to do the job. Now, getting the patient down to ultrasound room or let us fill up all these forms and those things are funny. Antenatal, if you do with the other discipline, it becomes very funny. Secondly, I don't see ultrasoundist daily. Suppose my ultrasoundist goes on leave, the other ultrasoundist doesn't come because the problem is that form and what that act is. I'm not sure what it is, but they will not come because they have not been listed to do that ultrasound on that machine. So there is always a problem of doing this. On the other hand, see the technique is becoming so and so better. Now we have handheld ultrasound. And I would have been lovely, I would have liked to do ultrasound on my OPD patients to see their heart. Instead of using the stethoscope, I would have used ultrasound probe to see what is wrong with the heart. It is so easy. And that we are deprived of because of these laws and other things. It should have been more freely used, but it has been restricted to very, very few people. And that too under very draconian laws.
Yeah.
So this thing is very troublesome for day-to-day practice. I would have loved to use ultrasound in everybody. If the patient has pain abdomen and I have to diagnose, why can't I or my friend ultrasoundist come over and just take a look at the abdomen? 90% of the problem would have been solved. But this is not happening because of so many laws and so many problems. I think we should have been using these techniques more freely, without much fear and favor. And I think the problem lies more with the society than with the doctors. We must act at the level of society, which has been done. See in the South, why South is different from North? Why sex ratio is getting better in South and not altering in North, despite the same law being applied all over India? So these are a few questions which I think Mr. Anil Dave very, very well, he covered up this part, and I agree completely with him. Thank you.
Thank you, Dr. Rajiv. So, very next question to Dr. Sandeep Miglani. Dr. Sandeep Miglani is the ex-additional director of the DGHS. And being at the high level post in the government, what kind of the challenges, the issues are you getting regarding the imaging techniques? Dr. Sandeep Miglani, please.
Good evening. I hope I am audible.
Yeah.
Yes, yes, you are audible.
Basically, first, I would not like to repeat the things which Justice Dave and Rajiv Gupta has said. Basically, these are the things which are very important also. And I'm a great fan of Justice Anil Dave. We have not met personally any time, but because of his judgment in 2013, I think, if I remember, the NEET PG examination, where it was a dissent judgment, and now the things have been implemented. That dissent judgment is practically is a now law. Leave aside, like when I was a additional CDMO and a nodal officer for PCP and DT, like in 2014 in North and Northwest district, I started the online F form. That if you fill the form and submit it online, nobody can pick you for any discrepancy, minor discrepancy that you have not followed the law. That just if you fill the form, submit it online, or even you can keep a copy of that, and nobody will catch you. And for at least for minor discrepancies, I hope that it is still prevalent in Delhi, and North was at that time the first district in India which started this thing. Secondly, regarding the appropriate authority, like in Delhi, is a DM, Deputy Commissioner in the most of the state, whereas in some state it can be a civil surgeon also. But most of the state, since it is a central law, as per that, it's a DM is the appropriate authority. And DM is a bureaucrat, and that also a very junior in the ladder as compared to a doctor, civil surgeon, who is at the highest in the ladder. And bureaucrat does not understand all these things. And there are a lot of deficiencies which has been admitted, like you cannot do a portable ultrasound. Now the machines have improved a lot. You can do an ultrasound just by putting a probe with your mobile, and you can do an ultrasound. And like ectopic pregnancy, which can be a life-threatening, and diagnosis is only made after an ultrasound most of the time. At least it is confirmed by after the ultrasound, and it can be done by. It may not be possible. Patient may not land with a gynecologist or an ultrasoundologist for a diagnosis. It may land with the physician or with a general practitioner, and he can do an ultrasound and can save a life. And the PPH and causes of postpartum hemorrhages, pericardial effusion. There are so many life-saving emergency where just a single 2 minutes ultrasound can diagnose the thing, and pericardial tapping can be done at that very time, and it can save a life. Basically, PCP PNDT Act must go now. Basically, it must be replaced by some appropriate act. Otherwise, there was an MTP Act also, like in 1970, where it was mandatory to take opinion of 2 gynecologists once the pregnancy is above the 12-week. 12-week because it is the time when you can diagnose the sex. There was already a resisting law, MTP Act 1970, where you can prevent the sex determination. And now Government of India is running an MCTS portal. That portal, whenever the pregnancy is registered, and all follow-up ultrasounds, all can be online put on MCTS Government of India portal. So at this time, the PCP&DT Act is just creating an obstruction. If you diagnose a pregnancy, put on an MCTS portal, you can know the outcome. Government can follow. Government official can follow the outcome also. Like there's no harm in putting like now if you say that we will tell the diagnosis to the government that is a female child, who is the job of the government to save that child, just like any other country. But presently MCTS portal in Government of India, it is working well. Immunization, all ANC follow-up can be put on online, just like your Covishield vaccine or vaccine status of any citizen, like regarding the COVID. So these things are available now with the technology. I think law needs to be changed or replaced by an appropriate law. Thank you.
Thank you, Dr. Miglani. Very nice.
Dr. Chhabra.
Yeah.
I am Dr. Rajiv Sood. I have to go for a meeting. Can I make comments which you wanted me to make?
Sir, sure.
Okay. So I'll first of all I'll thank Dr. Chhabra. I'm seeing such a brilliant galaxy star galaxy of debaters today, and Dr. Justice, Dr. Rajiv Gupta, Justice Anil R. Dave, Maglani, so many, Shivani Mehra, all are so close that I have seen them speaking today, but I am taking totally different aspect of all this debate. Just listen to me, that we are, sex preferences are social problem, first of all. The second thing is that what we are discussing, we can conclude there are three things. One is the law, another is the ethics, and third is the rules to implement. Law is not draconian. The rules are draconian, their implementation is draconian. And therefore, the law making authority should also see that how the rules are implemented. The implementation, as had been rightly told, that is as a very low, junior level of the bureaucracy. So this is Babu Raj, which has destroyed our fiber of our clinical acumen and also the clinical practice. Coming to the ultrasound, ultrasound is no more imaging technique. In the medical schools, medical books, it is totally changed. Now it is the extension of the examination. It is the arm, like you are examining, and ultrasound is no more imaging. It is just your examination skills. And ultrasound, as Dr. Rajiv Gupta was mentioning, it has to be in your hand to diagnose the disease. And also for the interventionist, the person who is doing interventions, everybody has to learn ultrasound. Like I'm a urologist. If kidney transplant, I headed the Department of Urology kidney transplant. You see cancer prostate, ultrasound is needed. You have to remove the stone, ultrasound is needed. You have to break the stone, ultrasound is needed. And if you have to do PCNL, any procedure you say, if you don't have ultrasound, you are handicapped. And to use ultrasound, if so many strict rules are there, I remember when I was fighting for the rights of the doctors, T.N. Sheshan, those who know that he was the chief election commissioner, very tough person. And when I argued for certain rules, the Central Health Service rules, he told, smiling, that these are the bureaucrats. What is bureaucrat? Bureaucrats. So he mentioned that we make everything very tough, and what rules can be relaxed, law cannot be relaxed. That is why I am telling that the laws are not draconian, they are very carefully drafted, but the implementation by bureaucratic procedure is at casualty. Now I'll touch to the third aspect, which is not discussed till now. What is the sex determination? It is, I told, is the societal preferences. And once you know the sex, see the other positive points. You are, for rest of the pregnancy, you know that what is going to happen. You are tension free. You have to use the ethics and social values, and you have to appreciate and inculcate those values into your population. Now coming to the sex determination, is it only ultrasound? Is only PNDT Act is sufficient? No. Now you know that gateway genomics have come, and in gateway genomics, the seek, peep at early, the diagnostic test is available. Like cancer can be diagnosed from a cell genome. Now at the pregnancy of 8 weeks or to 18 weeks, you can determine the sex. So are these rules, these laws applicable on that also? No. So how it is not important that how you are determining the sex. I'll go now one step further. Poultry, the cattles. Now Indian government, for the commercial reasons, for the economic reasons, they have told that by 2050, sex determination in the cattle is encouraged. And they are giving ultrasounds. The cattle is being known, and even after slaughtering, to know that which meat is this. This is a male or female meat. the dead protein, dead works proteins are determined, and you can know the sex from the tissue also. So now genomics are available. The lawmakers should realize that sex determination is not only by ultrasound. Ultrasound is mandatory. It is the extension of your examination skills, and it should mean that the doctor, the clinician should not be handicapped. You need it for the examination, you need it for the diagnosis, you need it for the intervention, and not only gynecologists need it. It is needed by physician, it is needed by urologist, it is needed by each and every skilled physician or surgeon. And even in the during the operation, if I have to remove the tumor, I have to use the intraoperative ultrasound to find out the missing tumor or the edges of the tumor which are to be removed. Otherwise, there will be recurrence. So these are, in my department, I have 4 ultrasounds. So this is very difficult law, and this should be amended, and we should go all out. When you are giving to villages, remote places for veterinary practice, that you determine, and the male calves should not be born, and they are aborting them. So don't you think that this will be used by others also? So therefore, it is very important that we understand, revisit the entire law, and also make the amendment necessary, and we make the rules modified and also implementable and acceptable, and those of the doctors or in power, the bureaucrats who are misusing the law and also making it difficult. They are forcing us to a stage that we are debating it. This is a tool in the hands of doctors, and we are forced to discuss whether to use it or not, how to prevent the misuse, how to prevent the draconian rules. That is more important today, and therefore Justice Dave is there with his influence, and also with the influence of the people like Miglani, people like other physician, API, and other bodies, our Urology Society of India, gynecologists, the FOXY and all. They should all join hands, and they should inform and inculcate the knowledge and awareness that ultrasound is no more the only tool to determine the sex, and all related PNDT provisions and rules which have been misused. So many doctors have been punished unnecessarily. They are to be repealed, and also we have to modify the whole thinking. We have to modify the whole rules book, and also we have to modify the implementation. So this message we can give to the public and to the authorities, that will solve all our problems and need of such debate.
Thank you very much, Dr. Rajiv, for the nice comments and eye-opener, rather, I will say eye-opener comments. Thank you very much. So the media limits the utility of the imaging techniques. Prompt media judgment without knowing the facts always unrest the everyone, doctors, public, and the authority. So they make the things fast to the real thing. There is no accident with the views of the photography. They prove it is a false. So negative approach by the media, by sting operation, negative approach creates an unrest and unseen fear among the public. Healthcare providers leads to violence or the assault. This is the problem with the negative approach to the media. So now question to Dr. Raj Shekhar Yadav from the Rajasthan Behrod. What are your views about the media which creates controversies among the ultrasonologists, authorities, and the public, and exploit the doctors, as in the recent case of the ultrasonologist, lady doctor who injured herself due to the blackmailing by the miscreants. Dr. Raj Shekhar, please.
Thank you, Chavda sir, for inviting me for this wonderful meeting. जैसा कि सर ने कहा था कि PNDT एक्ट बेसिकली मैं इसको यदि समराइज करूं तो वी आर ट्रीटिंग सिम्टम रेदर देन द डिजीज. जो सोशल प्रॉब्लम थी उसको हमने इस तरीके से ट्रीट करने की कोशिश की है कि शॉर्ट टर्म पे हो सकता है हमारे को इसका कुछ बेनिफिट दिखाई दे, लेकिन लॉन्ग टर्म पे जब तक हम सोशल लेवल पे इस रूट को जो है उसको ट्रीट नहीं करेंगे तब तक ये समस्या का समाधान नहीं होगा। जहाँ तक मीडिया का सवाल है, मीडिया केवल अल्ट्रा सोनोलॉजिस्ट या रेडियोलॉजिस्ट के मामले में ही गैर जिम्मेदार नहीं है, बल्कि हेल्थ केयर और चिकित्सकों से जुड़ी हुई लगभग हर न्यूज़ एक तरफा होती है। बिना वो होमवर्क किए, बिना स्टडी किए, बिना रिसर्च किए वो गैर जिम्मेदाराना तरीके से समाचार प्रकाशित करते हैं। उससे डॉक्टर्स की और हेल्थ केयर प्रोफेशनल्स की जो छवि है वो समाज में खराब होती है। डॉक्टर और पेशेंट के बीच में अविश्वास बढ़ता है और उसका नतीजा हम आए दिन जो अस्पतालों में वायलेंस की घटनाएं हो रही हैं उसके रूप में कहीं ना कहीं देखते हैं। तो मीडिया का जो ड्यूटी था कि उसको डॉक्टर और पेशेंट के रिलेशन को मजबूत करने की दिशा में कोई प्रयास करने चाहिए थे, उसके बजाय वो उल्टी डायरेक्शन में कर रहे हैं, जो कि बहुत ज़्यादा दुखद है। अभी धौलपुर में जैसा कि आपने बताया एक घटना हुई थी जिसमें एक रेडियोलॉजिस्ट अल्ट्रासाउंड कर रही थी और बहुत गलत तरीके से उस न्यूज़ को रिपोर्ट किया। उन्होंने पेशेंट को अनकवर करने के लिए कहा था और उसको इस तरीके से रिपोर्ट किया गया कि वो सोनोलॉजिस्ट थी, वो अल्टीमेटली डिप्रेशन में चली गई और उन्होंने अपने आप को हर्ट भी किया। इसी तरह जो लालसोट की घटना थी उसका तो पूरे देश ने देखा कि किस तरह से एक गलत तरीके से न्यूज़ जो आइटम आया था अगले दिन न्यूज़पेपर में, और उसी वजह से डॉक्टर अर्चना शर्मा को इतना एंजाइटी और डिप्रेशन हुआ कि वो उन्होंने सुसाइड तक कर लिया। तो मीडिया का जो रोल होना चाहिए था, हेल्थ केयर की अच्छी चीज़ें, हम डॉक्टर्स कितने अच्छे काम करते हैं, पूरे दिन में हजारों ऐसी सर्जरीज होती होंगी, रेयर सर्जरीज होती होंगी जिसमें डॉक्टर से बहुत सैकड़ों मरीजों की जान बचाते हैं, लेकिन हम कभी भी ऐसी पॉजिटिव न्यूज़ देखने को हमारे को कभी भी नहीं मिलती है। और नेगेटिव कोई खबर होती है उसको इतना बढ़ा चढ़ा के सेंसेशनलाइज करते हैं, वन साइडेड रिपोर्टिंग करते हैं, तो उससे जो मिसट्रस्ट है वो बढ़ता है। तो मीडिया हाउसेस को ये इंश्योर करना चाहिए कि हेल्थ केयर से रिलेटेड जो भी न्यूज़ है उसमें पहली बात तो जो एजुकेटेड जर्नलिस्ट हैं वो ही रिपोर्ट करें, वो प्रॉपर रिसर्च करें, डॉक्टर्स का भी वर्जन ले, नेग्लिजेंस और कॉम्प्लिकेशन में फ़र्क समझने की कोशिश करें। हर प्रोसीजर के कॉम्प्लिकेशन होते हैं, कई बार ह्यूमन एरर भी होती है, मशीनरी की भी आपकी एरर हो सकती है। आप एक पायलट जब प्लेन उड़ाता है और दुर्घटना होती है तो हम उसको ह्यूमन एरर कह के बोलते हैं, लेकिन यहाँ पे केवल नेग्लिजेंस ही सुना जाता है, कॉम्प्लिकेशन को भी नेग्लिजेंस बता के पेश किया जाता है। तो मीडिया की जिम्मेदारी है कि नेग्लिजेंस और कॉम्प्लिकेशन में वो फर्क आम जनता को समझाने की कोशिश करें। थैंक यू।
So you mean the media is a culprit, main culprit?
बिल्कुल सर।
The negative role. So next reviews. So next is very important question to Dr. Meenakshi Sharma. She is also from the Rajasthan Naval Guard. Dr. Meenakshi, being a lady doctor and a gynecologist, being from the Rajasthan, what about your learning from this lady doctor who has injured herself due to the exploitation or the blackmail by the journalist? So what is your view or what is your learning about this case? Dr. Meenakshi. Dr. Meenakshi not there?
मीनाक्षी आप अनम्यूट कर लें।
अनम्यूट कीजिए मीनाक्षी।
डॉक्टर मीनाक्षी अनम्यूट करें।
डॉक्टर मीनाक्षी,
मीनाक्षी अनम्यूट करें।
Dr. Meenakshi?
हाँ,
yes, come, she is coming.
सर, थैंक यू सो मच फॉर इनवाइटिंग मी। सर, जैसे कि मेरे से पहले सभी वक्ताओं ने बताया कि कन्या भ्रूण हत्या एक सामाजिक समस्या है। अगर एक भी कन्या कोख में कत्ल होती है तो वो आपकी, हमारी, चाहे प्रशासन हो, चाहे डॉक्टर हो, चाहे समाज हो, और उसके जिसके कोख में पल रही है उस औरत, सबकी जिम्मेदारी है। लेकिन सर, हमारे जो आज का सिनारियो है उसमें पीसीपीएनडीटी एक्ट बनने के बावजूद भी आज एक डॉक्टर और समाज दोनों के बीच में एक लाइन सी खड़ी कर दी गई है। कन्या भ्रूण हत्या का जिम्मेदार सिर्फ और सिर्फ रेडियोलॉजिस्ट या डॉक्टर जो सोनोग्राफी कर रहा है उसी को जिम्मेदार माना जाता है। जैसा कि राजस्थान में पिछले गत वर्षों में जो केसेस हुए हैं उनमें सब में सर मोर देन 70% केसेस ऐसे थे जो पहले डिस्कस करके गए हैं मेरे वक्ता कि माइनर क्लरिकल ह्यूमन क्लरिकल मिस्टेक्स जो है, मानवीय भूल है, या एप्रिन नहीं पहना, इस तरह की घटनाएं एप्रोप्रिएट अथॉरिटी ने मशीन सीज कर दी, रिकॉर्ड सील कर दिया। जैसा कि माननीय जज साहब ने कहा कि जुडिशरी हमेशा लीनियंट रही है, और सर मैं मानती हूँ बिल्कुल रही है, इसी तरह के अनेकों केसेस वहां से बरी हुए। लेकिन सर इस बीच में जो मानसिक यंत्रणा, जो प्रताड़ना, जो फाइनेंशियल लॉस, जो कोर्ट कचहरी के चक्कर डॉक्टर्स को भुगतने पड़ते हैं, क्या वो सही है सर? सर नैतिक प्रश्नों के उत्तर कानून नहीं दे सकता सर, कानून उन्हें कम कर सकता है लेकिन रोक नहीं सकता। सर कानून बनाने वाले और कानून की पालना दोनों को ये सोचना चाहिए कि कानून में इस तरह के जो लूप होल हैं, उनसे जो असामाजिक तत्व हैं, जो अपने निहित स्वार्थों के लिए कुछ ऐसी असामाजिक एक्टिविटीज करके और डॉक्टर्स के ऊपर ये ब्लेम लगाते हैं कि वो सिर्फ और सिर्फ कन्या भ्रूण हत्या के लिए जिम्मेदार हैं, ये सर पूरा गलत है। पीड़ित मानवता की सेवा के लिए बने हैं हम। जैसा कि मेरे से पहले गायनोकोलॉजिस्ट सब ने बताया कि बहुत सी ऐसी इमरजेंसीज होती हैं, प्लेसेंटा प्रीविया है, एक्टोपिक प्रेगनेंसी है, बहुत सी ऐसी अनेकों इमरजेंसीज होती हैं जिसमें आपको छोटे छोटे आधार कार्ड नहीं है, आईडी नहीं है, फोन नंबर नहीं बता पा रही है पेशेंट, आप उसके लिए इतना डिले होता है कि पेशेंट को अपनी जान से हाथ तक धोना पड़ सकता है। और पहले भी बहुत से वक्ताओं ने बताया कि बहुत से ऐसे इंटरवेंशन होते हैं कि अगर आप पीसीपीएनडीटी एक्ट में थोड़ा सा लीनियंट हो और जो आपकी एप्रोप्रिएट अथॉरिटीज हैं वो चिकित्सा विज्ञान को समझें और चिकित्सा विज्ञान की संवेदनाओं को समझें और उनके अनुसार अगर लीनियंट हो तो समाज को चिकित्सक बहुत ज्यादा दे सकता है, पेशेंट को फाइनेंशियल बर्डन कम हो सकता है। सर कितनी बार होता है 3 महीने तक की प्रेगनेंसी है, आपने फर्स्ट ट्राइमेस्टर में एक बार अल्ट्रासाउंड करा ली, लेकिन 8 वीक्स के बाद अगर वो मिस्ड में चली गई तो क्या आप बार बार पेशेंट को सोनोग्राफी के लिए कहेंगे? क्या उसके ऊपर फाइनेंशियल लोड नहीं बढ़ेगा? सर ये राजस्थान में ज्यादा है, गुजरात में और अदर स्टेट्स में देखा है कि आराम से प्रोब रखकर गायनोकोलॉजिस्ट ये बता देती है कि हाँ फीटल कार्डियक एक्टिविटी सही है, लेकिन राजस्थान में ऐसा नहीं होता। जितनी विजिट हो आपको बार बार पेशेंट की अल्ट्रासोनोग्राफी की रिसिप्ट कटवानी पड़ेगी, आपको फॉर्म एफ भरना पड़ेगा, आपको फिर पेशेंट की सोनोग्राफी करनी पड़ेगी। अल्टीमेट बर्डन किसके ऊपर हुआ? पेशेंट के ऊपर हुआ, सोसाइटी के ऊपर हुआ। सर कानून बनाने वाले मानती हूं मैं, लेकिन कानून की अनुपालना ऐसे ढंग से होनी चाहिए कि जो असामाजिक तत्व हैं, जो अपराधी हैं, उनमें खौफ होना चाहिए, लेकिन जो अपना काम सच्चाई से, जो अपना काम ईमानदारी से कर रहे हैं, उनको एक भय उन्मुक्त वातावरण मिलना चाहिए कि वो पीड़ित मानवता की सेवा के लिए बने हैं और वो अपना धर्म निभा रहे हैं। लेकिन सर जैसा कि माननीय दवे सर ने कहा, जुडिशरी लीनियंट है, लेकिन जो अप्रोप्रिएट अथॉरिटी है उनकी प्रॉपर ट्रेनिंग होनी चाहिए। उसमें कौन आपका ऐसा है कि जो आकर आप डॉक्टर्स के ऊपर चेक करेगा? एनजीओज हैं, फर्जी एनजीओज ऐसे पनप रहे हैं जो भाड़ा लेते हैं, वसूली करते हैं, ब्लैकमेलिंग करते हैं। स्थानीय पत्रकार होते हैं सर जो अगले ही दिन ये छापते हैं कि फलां सोनोग्राफी सेंटर लिंग परीक्षण करते पकड़ा गया, चाहे उसमें कोई मैटर नहीं बनता हो। सर स्टिंग ऑपरेशन ऐसे ऐसे हुए हैं जिनमें नाजायज तरीके से पैसे फेंक दिए गए और रिकॉर्ड सीज करके चले गए। सर ऐसे कानून के जो लूप होल है, ऐसे जो ये पीसीपीएनडीटी एक्ट का दुरुपयोग बंद होना चाहिए, ताकि ऐसे चिकित्सकों को जो अभी हमने देखा है कि मानसिक जो प्रताड़ना भुगतनी पड़ती है। डॉक्टर अभी जो धौलपुर में केस हुआ है एक मीडिया की उस लापरवाही की वजह से, उन सब के ऊपर एक ऐसा शिकंजा होना चाहिए कि डॉक्टर, सिर्फ डॉक्टर जिम्मेदार नहीं है, भ्रष्ट तंत्र पूरा जिम्मेदार है इसके लिए। उन सबको आज तक आपने जैसे मैडम ने बोला, किसी ने भी एक ऐसा केस दर्ज हुआ कि हाँ फला दंपति भ्रूण परीक्षण के लिए डॉक्टर के पास गए? सर क्या एक भी ऐसा एप्रोप्रिएट अथॉरिटी पर केस हुआ, यहाँ साइन नहीं किया, यहाँ साइन नहीं किया? सर उनकी खुद के ही रूल क्लियर नहीं है, किसी को पीसीपीएनडीटी एक्ट का पता ही नहीं होता। उनके 4 व्यू होते हैं, एक कहता है यहाँ साइन 2 बार होने चाहिए, एक कहता है यहाँ। तो सर जो अप्रोप्रिएट अथॉरिटी की टीम है उसमें ऐसे लोग होने चाहिए जो सदचरित्र हो, जो निष्पक्ष हो, जो ईमानदार हो, जो लर्नड हो, और फिर उनकी ट्रेनिंग होनी चाहिए, और फिर आप उनको डॉक्टर्स के ऊपर, सर सबके नैतिक जिम्मेदारी सबकी होनी चाहिए, तभी इस समस्या से उबरा जा सकता है। सर खौफ नहीं होना चाहिए डॉक्टर्स के ऊपर। असामाजिक, चाहे वो डॉक्टर्स में से हो, चाहे वो प्रशासन में से हो, जो असामाजिक तत्व होते हैं उनको अपराधी की दृष्टि से देखा जाना चाहिए।
Thank you. Thank you, Dr. Meenakshi, for nice words. So now we will come to other views from the Dr. P.K. Goel. Dr. P.K. Goel is here? I think not here. Dr. Kiran Chhabra. Dr. Kiran Chhabra.
So good evening, everyone. After listening to all of you, all the dignitaries, including my president, Dr. Abha Sood, and then Justice Dave, Dr. Sanjeev Miglani, Dr. Sushila Ji, Dr. Gaurav Agrawal, Dr. Rajiv Sood. दो तीन चीजें सामने आई हैं कि पीसीपीएनडीटी एक्ट मेरे हिसाब से stringent law है. Law should be there to prevent the misuse. But laws should not be to strangulate the doctors to the effect that they are not able to use the wonderful technology of ultrasound up to its maximum effect. As elaborated by Dr. Abha Sood, that in infertility clinics, they want Form F to be filled. For ectopic pregnancies, they want Form F to be filled. So in all these cases, doctors are hesitating to do their activities because they have to fill so many forms. Even we have seen many ultrasonologists, they are shifting away from the gynecological ultrasounds because they do not want all the mishaps from the society, media, and the filling of these forms, and then get punished for small things which are mistakes, small mistakes which occur while filling the forms. Second and most important thing which comes to my mind after listening to all this, why this law is not taking those people under its gamut who come to the doctor's clinic for getting these ultrasounds done. I don't ask the patients to come to my clinic to get the ultrasound done. Somebody from the society is coming to me and then she or he is getting the ultrasound done. What our laws are doing for those people? उनको क्यों सजा नहीं दी जाती है या उनके बारे में क्यों सोसाइटी में ये वो नहीं है कि भाई आपको सेक्स डिटर्मिनेशन नहीं कराना चाहिए, या जैसे किसी ने कहा कि अगर डॉक्टर ने देख लिया कि वो फीमेल बेबी है तो आगे वो पास ऑन कर दे गवर्नमेंट को कि इस प्रेगनेंसी का अल्ट्रासाउंड करने में उसे फीमेल मिला, तो क्या हमारी सरकार उस डॉक्टर को प्रोटेक्शन देगी अगर कल को कोई प्रॉब्लम होती है? अगर वो डॉक्टर आगे मैसेज भेज देता है तो क्या उसको कोई प्रोटेक्शन दिया जाएगा? तीसरी और बहुत इंपॉर्टेंट बात है कि जो मुझे लगता है कि बहुत सारे टेक्नीशियंस बहुत सी छोटी छोटी गलियों में, वन ऑफ माय फ्रेंड्स इज वर्किंग इन हरियाणा गवर्नमेंट एंड शी हैज टोल्ड मी दैट देयर आर मेनी मशीन्स हु आर वर्किंग राउंड द क्लॉक इन स्मॉल सेटअप्स नहीं, कमरों में, छोटे छोटे घरों के छोटे छोटे कमरों में अल्ट्रासाउंड की मशीनें काम कर रही हैं जिसमें डॉक्टर नहीं कर रहा है वो अल्ट्रासाउंड, कोई और कर रहा है। तो उन पर हमारी गवर्नमेंट का क्या टेक है? उन पर हमारे लॉस का क्या टेक है? वो हम लॉस कब बनाएंगे? क्या हम तब सोचेंगे जब हमारे सारे डॉक्टर्स या तो स्ट्रैंगुलेट हो जाएंगे या बहुत सारे सुसाइड कर लेंगे या बहुत सारे प्रैक्टिस छोड़ देंगे? और चौथी और बहुत इंपॉर्टेंट बात, जब हमें ये पता है कि ये सोशल कॉज है, सोशल प्रॉब्लम है, तो गवर्नमेंट इस चीज को, गवर्नमेंट सोसाइटी इस चीज को क्यों नहीं उठाती है कि भाई लोग सेक्स डिटर्मिनेशन ना कराएं, जाकर के डॉक्टर्स के पास ना जाएं? क्यों ऐसा है कि हमारी सोसाइटी में चेंज बहुत स्लो है? जस्टिस दवे ने कहा बहुत सारी गायनेकोलॉजिस्ट हैं, सर 30,000 से भी ज्यादा गायनेकोलॉजिस्ट हैं इंडिया में, और मेरे ख्याल से उतने ही ज्यादा एडवोकेट्स होंगे जो आज की डेट में गर्ल्स हैं हमारी सोसाइटी में जो काम कर रही हैं, पर फिर भी हमारी सोसाइटी में सेक्स डिटर्मिनेशन आज भी उतना प्रॉम्प्ट है। क्यों? क्योंकि हम लोअर लेवल तक इस बात को नहीं पहुंचा पा रहे हैं कि हमें ये सेक्स डिटर्मिनेशन नहीं कराना चाहिए, क्योंकि हम लोअर बात पर लेवल तक लोगों को एजुकेट नहीं कर पा रहे हैं कि ये सेक्स डिटर्मिनेशन गलत है, कि फीमेल्स हमारी सोसाइटी का एसेट है, वो हमारी सोसाइटी के लिए एक धब्बा नहीं है। और लास्ट बट नॉट द लीस्ट, मीडिया का जो रोल है वो उसके लिए हमारी गवर्नमेंट को कुछ ऐसा करना चाहिए कि मीडिया पॉजिटिव फाइंडिंग्स ऑफ द डॉक्टर्स जरूर दिखाए। किसी जमाने में आप सब जानते हैं कि एक मिस्टर खान थे कोई, जो एक शो में आए और उस बंदे ने हमारे फैब्रिक जो ट्रस्ट है ना बिटवीन द डॉक्टर्स एंड सोसाइटी, उसको टोटली ब्रेक किया। उसने इतनी बात, लेकिन हमारी किसी भी एसोसिएशन ने, किसी भी गवर्नमेंट ने, किसी भी सोसाइटी ने उस बंदे को क्रिटिसाइज नहीं किया। वो दिन का दिन है और आज का दिन है। ये जो ट्रस्ट है बिटवीन द डॉक्टर एंड सोसाइटी इज ग्रेजुअली डिक्रीजिंग, जिसमें डॉक्टर्स की गलती बहुत कम है। डॉक्टर्स का काम जो है वो गलत करना नहीं है। डॉक्टर्स हमेशा कोशिश करते हैं अपने पेशेंट को बेस्ट देने की, क्योंकि अगर आज मैं अपने पेशेंट को बेस्ट दूंगी तो कल वो 10 और मरीज मेरे पास भेजेगा। अगर आज मैं गलत काम करूंगी तो वो और मरीजों को मेरे पास नहीं भेजेगा। तो मुझे तो अपनी वैसे ही इमेज बचानी है, मैं गलत काम क्यों करूंगी? और ये चीज जब तक गवर्नमेंट और सोसाइटी नहीं समझेगी तब तक हमारे डॉक्टर्स की सिचुएशन जो है डॉक्टर अर्चना के जैसे होने वाली है। Sorry to say that.
Public awareness is very, very
So
important.
public awareness is the most important thing which we should put our heart and soul into it now. Doctors का पीछा छोड़ दे सरकार.
Now Dr. Bahar is there. Dr. Bahar, young gynecologist. Dr. Bahar is there. I think Dr. Bahar is not there. So in conclusion to make the strong healthcare system, softening rules and regulation with a special consideration in the field of the medicine practice, as it is evidence, experience, and the social basis, so that we can provide the better service to the public for which we are morally bound, and enhance the coordination and updating the public at large about the hazards of the female foeticide time to time to increase the female ratio in the society, and punishment to the culprit doctor only for the negligence, not for the error in the making the decision after the proper investigation, not on the second or third day for the 302 as in the Dr. Archana case. So media must be out of the healthcare system for improving the delivery of the healthcare system. And if we want to work, they want to work with the positive approach to help the healthcare provider to deliver the better service to the society. So the real positive effect will definitely encourage and boost the enthusiasm of the healthcare workers, especially the doctor. That, as Dr. Kiran said, positive side of the doctors should also be shown in the media, and that will lead to better healthcare service. So challenges have made the utilization of the imaging techniques in diagnosis and treatment and create a gap in between, just like a bridge, due to the incoordination among the authorities, doctor and the public. Let us work together as a team to cross this gap like this. This is the authority in between the doctor and the health provider and the public, because we have the gap in between we have to fulfill. So to deliver the best and excellent service to the people at large, if the media plays a positive attitude sport, it will definitely refine this system. So take a message, change our attitude, and do work with the holistic approach by keeping all the pros and cons of the rules and regulation. As Dr. Rajiv Sood said, the regular implementation of the rules should be proper, and before implementation of the healthcare system in the balanced manner, so that we can provide the best healthcare service for the which we are morally bound. So what do we want? We want the clapping and the drumming of Thali, candle lighting. Answer, big no. So we want the central law against the violence on the doctor and the medical establishment. We want appeal to our people by our Honorable Prime Minister to stop the violence against the doctor in the Man Ki Baat, which is a very popular program, at least once, or if possible, every episode, either at the outset or at the end. We want safety at the working place with the zero violence. So what a thought of today in the CPA era, a murder is innocent till proved guilty. A doctor is guilty till proved innocent. So let us come together to reverse this quotation. So we don't want another Dr. Archana Sharma in the future. So we want the justice for the Dr. Archana Sharma. So thanks very much. Now I give the mic to hand over the mic to Dr. Parveen Bhatia, Program Director, for the further proceeding and the chat for question. Dr. Bhatia, please.
Thank you very much. Thank you very much. We have friends. I have listened to all the discussion especially by Justice Sunil Dave also. Basically, if we go in the pre-ultrasound era, around about 19th century, we can say, at that time, very sensitive issue. Female infanticide was there. Very sensitive. So basically, it's a society which has to be taught that females are the important part of our society. It's such type of, maybe ultrasound is not yet the culprit. And ultrasound should be allowed if my voice can go through this platform for the other routine works more freely, fearlessly. I have got few questions in the chat box. One question is from Dr. Naveen from Kanpur. As Dr. Shivani Mehra has already said that ultrasound should be allowed only by the learned MD radiology persons. But as today we are doing every nook and corner, Dr. Kiran also pointed, even unqualified persons are doing ultrasound under the name of some other doctor. So, not to speak of the facts right now, we are here. But I would like to just, he wants to know, Dr. Naveen wants to know from Kanpur, who can do ultrasound, but the minimum qualification required by the Medical Council of India or our legally who can do ultrasound? Is it the MBBS who can do ultrasound or some experienced person or only MD radiology? I think Dr. Agarwal, Gaurav Agarwal is the right person to answer this question. Dr. Gaurav Agarwal on the stream.
Dr. Agarwal is there.
So as far as the PCPNDT Act is concerned, even MBBS persons with a certificate from a ultrasoundologist can conduct ultrasound. I know many persons who are MBBS wives of MD radiologist doctors, and who have obtained a certificate from their husband that they can perform an ultrasound are doing it, and submitting Form F regularly. So regarding this, Dr. Shivani would have been the best person, but there's already a case in the Supreme Court, Indian Radiological Association versus Government of India, and this case has been going on for almost, I think, 4 or 5 years now. So the Supreme Court has mandated that there be a test conducted to assess the knowledge of the MBBS ultrasonologists. And this test is already being conducted in several states. In the state of Delhi, it is scheduled, I think, in the month of July or something. So, see, there are loopholes. The loophole was already made due to whatever wisdom of the government of the day in the PCPNDT Act. And that loophole is being, is well organized now and is being taken advantage of MBBS sonologists. So as far as PCPNDT Act, yes, the MBBS doctors can conduct ultrasound, but for all other purposes, only diploma holders and MD radiology persons can conduct ultrasound.
Thank you very much. Thank you very much. The next question is from Dr. Gautam from Agra. He's saying that he's a nursing home owner and basically he wants to have ultrasound machine, but there's a lot of paperwork, registrations, not being able to use the machine so frequently. So what can be done? How the changes can be brought in the legal system? Justice Anil Dave, you pointed out that it should be done more frequently. I would like to have your comments. How can we have encouraged doctors to use the ultrasound machine more frequently for the diagnosis of the patient? Justice Dave, please.
I firmly believe that they should be permitted. As Dr. Rajiv Gupta said, that you can have so many investigations within no time. Why should you not use it? But the law says something with the legislation that is not our job. Because we judges normally we implement the law. Now, if you can convince the legislatures that okay, do this thing or do that thing, if your MCI is so strong, and if you can influence the parliamentarians, then you can do something. But I firmly believe, personally speaking, as a citizen, as a judge also, I would say that why should they not be permitted to use it? And as Dr. Rajiv Gupta said that he can have it a very portable machine within no time, he can know. Why should the patient be sent somewhere else if he himself can do it? Why should he not do that?
But sir, challenge is law doesn't allow. After authority says that.
That's what I said. The law. That's what I said. No, the law should be changed. The law should not be such which would put us in difficulty.
Yes.
On the contrary, law should be meant. Law is for our facilities. We are not meant for law. Law is meant for us. But difficulty is our parliamentarians. They don't consider this thing. मेरी पार्टी वाला हाँ कह देगा तो everybody said 2 + 2 is 7, तो मेरी पार्टी वाला से yes 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 2 + 2 7 हो जाएगा. I mean, who considers this thing? Whenever there should be some discussion, but there is no discussion. I mean, this is not a place where I can say all these things, but we know it well. As enlightened citizens, we know how the laws are being enacted there. Who does that? What is the discussion? There are a number of laws which are enacted. There is discussion and people do not know anything about it. Nobody gets a chance to say something. Why should MCI not say these things? I think it is a work of MCI. You should go into
Justice Dave, your voice is breaking.
these things. He can definitely do it if there are complications. Of course, not permitted. Law should be amended. I firmly believe law should be amended.
Next.
There's something wrong. Am I audible?
No, your voice is breaking.
Breaking. Voice is breaking.
Oh, I'm so sorry. No, can you hear me now?
Yes, yes, we can.
No, I was just saying that as a matter of fact, MCI, the body of the doctors, they should try to convince the parliament that, okay, such type of law is required. Why should you not do that? You tell your health minister, you had a health minister who was a doctor himself, Dr. Harshvardhan, you can tell him, he can tell the people. But the unfortunate difficulty with us is we never discuss anything. Our members of parliament never discuss anything. Whatever the party in power says, they would immediately say yes. I just gave an illustration that suppose I am a person in power, I am a prime minister, I say 2 + 2 is 7. All my party men will say yes, 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 2 + 2 is 7. Now, how do you deal with these people? These are the shortcomings of our democracy. But in that case, you should do something. Your body should do something for the doctors. And that is ultimately it is for good for the society. Our cost will be less. As Dr. Meenakshi said, it's very expensive every time you go to a sonologist. I mean, sonographers, then and we are not rich people. Our country is a poor country. So it is better that if something is there at lower level, and if there are complications, you can definitely refer the patient to some radiologist.
Justice Dave, problem with your Wi-Fi. Your voice was. Thank you, Justice Dave, for the fruitful suggestions. Thank you very much. Any more questions by the panelists? There's one story told by a doctor, and I won't declare her name. कोई पेशेंट उनके क्लिनिक पे आया और पूछा कि क्या एसटी हो जाएगा? She was doing ultrasound. तो डॉक्टर ने बोला कि हमारे यहाँ एसटी नहीं होता है. और जो पेशेंट पार्टी है, वो स्टिंग ऑपरेशन था. उन्होंने पर्टिकुलर वीडियो से नहीं वर्ल्ड को निकाल दिया. नहीं वर्ल्ड को निकाल दिया. उस पर डॉक्टर को ब्लैकमेल करने की कोशिश की गई. तो इसका क्या? Blackmailing of the doctors. Sting operations, what is the solution? Any of my eminent panelists can answer. Any of my
Dr. Sandeep will answer.
Blackmailing is can happen anywhere, anytime, of any type. So that is basically that
very
is,
easy.
Basically, that forensic examination has to take place, and you have to prove the case. But otherwise, you have to take it on the front foot. Like why he is doing it, and you have to register.
Doctor is a soft target.
Soft target.
Everywhere
one question I want to ask from Justice Dave. Basically, am I audible, Justice Dave?
Yes.
Basically, the question is can we challenge this law saying that it's an ultra vires in the constitution because it prohibits all the doctors to use an investigative tool, and it's violating my fundamental right of every doctor in country.
It is difficult for the reason that each and every right has some limitation. Suppose today I say that I would like to practice as a doctor without having any degree. I said because I have worked as a compounder with so-and-so doctor for 20 years or 30 years and I know so many things about medicine. I have read internal medicine by Harrison thoroughly. You ask me anything and let me practice. Can I be permitted to practice? Answer is no, because there can be reasonable restrictions. Even our fundamental rights, Article 19 says each and every right has some limitation somewhere. So here, whenever there is a professional body, the body would put some restrictions. When you want to have some business, some profession, in that case, you have to abide by the rules and regulations of the profession. So you can't do that thing. That is not possible. And this restriction is quite reasonable. If you challenge it, you might not succeed perhaps, because this is a reasonable restriction. A person who is working as an expert, he must have expertise. if he's not having expertise, then how can you expect that person to work sincerely and effectively?
The changing technology
Say, as
basically
for
now.
example, MBBS, everybody is Bachelor of Surgery, but whether he would work as a surgeon, sir would know. See, basically your degree MBBS is Bachelor of Medicine and Bachelor of Surgery. Now, can you operate as a only MBBS? Would he be in a position to operate? Answer is no. DGO, I mean, for delivery, etc. Only that person can do. MBBS cannot do because there is requires some knowledge. And when you require some specialized knowledge, then you must have that thing. So that is a reasonable restriction. So if you challenge it, you may not succeed.
Nowadays, if we compare with the 20-year back, the diagnostic ultrasound has just become like mobile. You can use it for general purpose only, not for a specialized purpose. That's what I want to convey. Basically, like a simple
Then you have to convince.
do it.
No, you have to convince the authorities now. Then you have to convince the authorities that these are the things which we can do. My MBBS can do this thing. And you can say that in your curriculum you are having this thing and therefore you can do it. So you will have to make a representation through MCI. I think that is the best thing. Certain things somebody can do it also. Why should you go to an expert every time? Why should you spend money?
I have a question. Anybody can answer. If anyone knows that the machine sold, has government any law on that? That who can buy that machine? Ultrasound machine.
Like
for the purpose of purchase, there are regulations.
If you're selling the machine, you have to take the permission, and the one who is buying the machine, he has also has to apply, and where he's installing and what is the machine number, model, his bill, and all things he has to give the information, and where it is going to be installed now, who is buying it, from whom he is buying, is the both.
These are the provisions in the Act and rules.
Both the appropriate authority has to be informed. Like if I'm selling a machine in Delhi and that machine is going to some other city, then both the appropriate authority has to be informed. And
so how come these machines are used by quacks in small villages or small places?
Basically, the illegal thing can happen anywhere. Like that is an illegal activity.
So what laws our government is going to implement or put on such illegal activities?
Sorry to put a question to you. Rape and murder both are prohibited. Do you read it in newspaper that somebody has been raped or somebody has been murdered? What do we do? If there is something which is being done illegally, you can't do it.
But they are tightening the noose only on doctors. My question is because I want to know that why only doctors are being targeted for this.
Anybody is aware that he can inform the authority.
Why not other people who are violating these laws?
We have to make a complaint. Unless we make a complaint,
doctors are doing their duty.
The law. Why don't we make a complaint against those quacks? It is we who are at fault. We have to make a complaint. Then only the law knows that the authorities know that there is a violation of law.
Dr. Gaurav, I would like to say when long back I had a experience of politicians in my area. When they were trying to fight against quackery. So what they brought was DMC registration for doctors, which is going on for, which has been repeated every 5 years. Like I have to register every 5 years that I am a doctor, I am a gynecologist, I have passed out from this place and that place. And nothing has been done for quackery till date. Quacks are still flourishing. They are doing all sorts of nonsense things. And always the government is tightening the nose on, मतलब सरकार ऐसे कान पकड़ती है ऐसे उल्टी तरह से तो इसके लिए
एक छोटा कमेंट ले लो अब मैडम आपने जो बोला है I tell you I have got a echocardiography machine. This is also requires PNDT registration.
Yes.
So shifting from the basement to the first floor one has to take permission. आगे बोलते आपने परमिशन लिया नहीं आपने शिफ्ट कैसे कर दिया सेम बिल्डिंग में बेसमेंट से फर्स्ट फ्लोर में you have to take permission. So this is how ridiculous is the law, I can tell you. So I think it's a very
Dr. Bhatia.
Yes, no question now. I would request Krishna Jha, who is
he repairs your spine by just being and I know police officers and one of ministers on there. He is a person, he's somewhere in Surat or near Surat. So just if you have got a particular type of thing, then he would just ask you to lay down and then he would give a kick on your spine. And he said, now you are fine. He says, I know how the spine works and what is the functioning of the spine. And he does this thing. And people go there. I know police officers going there. Wives of ministers have gone there. That person is not a doctor at all. And he gives a kit. क्या करोगे आप? कितने लोग जाते हैं वहां? Now it is our fault, citizens' fault that we go there and we don't say anything. We don't file a complaint against that person.
So thank you very much. Thank you, Dr.
Yes,
Cha,
Dr.
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 Yes.
Jha is present with the
Yes, sir.
Fortis Hospital. I will request Dr. Jha to be on the screen for the closing remarks. Dr. Jha, please.
Yes, thank you, Dr. Bhatia, Dr. Chabra, for making such a thing. As a second, as a some noise is there, I think one has to be muted. As a secretary of this NDPF, and can you hear me?
Yes, Dr. Jha, you are right.
Yes.
Please carry on.
Yeah, noise is coming very. So,
Dr. Jha is senior consultant with the Fortis Hospital and secretary of the North Delhi Physician Forum. I will request Dr. Jha to kindly close the session. Dr. Jha, please.
yes. First of all, I want to say one thing. It is a very choti process hai to make aware and do some changes in our PNDT Act, or we improve our working as far as PNDT is concerned, or use of ultrasound is concerned, by North Delhi Physician Forum and the Delhi Gynae Forum, Northwest branch. So thank you both the organizations. And first of all, I must thank all the delegates, attendees who have listened to our opinion of the learned panelist. And Dr. and Justice Dave is the person, we really love him. We are planning in the earlier meetings also, but this time he could make it, and we are very wiser with his wise comments. So thank you, Dr. Justice Dave. Then Dr. Gaura Agarwal, we all know he's very regular in our meetings and with a very insightful thoughts. He is guiding us in all the panels and this thing, and we're guiding our practice also. Then I must thank all the female panelists, like from Dr. Avasud, she is the president of Delhi Gynae Forum. Dr. Kiran Chhavra, she is the secretary of Delhi Gynae Forum Northwest. Then Dr. Sushila, very popular, very academic. We have been listening her in a lot of forums. Then Dr. Shivani, the radiologist in our panel, and Dr. Meenakshi. She has given a very strong presentation and very forceful presentation she has given. Then I must thank all other panelists, our NDPF members, Dr. Rajiv Gupta, Dr. Milani, and other panelists like Dr. Rajiv Sood, very senior person. I must thank him. And last and Rajshekhar Yadav is a very medical activist. Being a practitioner also is a medical activist. His blogs are tremendous, very thought-provoking and very impressive. And Dr. Aram Chabra is everything as far as this association is concerned, NDPF, and he is doing very good work in all the panels. He is organizing the seminars, webinars. So he's a very wonderful. I must thank him from the bottom of the heart. And last but not the least, Dr. Praveen Bhatia, who moderated the session very well, with a very equal time to all the panelists, the questions and all. And finally, the organizer, Mr. Rahul Jain, who has done this, managed this webinar. So I must thank all and everybody for this wonderful session. And we must this must be a thought-provoking for changing the basics of the PNDT Act, and that can be done through the organizations like Dr. Justice Dave said, through the IMA, through our NDPF, through the API, all the organizations. They can go to the National Medical Commission or to the court. One can always try to change what is the bad part of the law, because law, I think, is not going to be repeated. So bad part of the law can be changed with the help of all the organizations, medical councils, NMCs, our organization, NDPF, Delhi Gynae Forum, Radiologist Association, API, ASIs, all these things. So thank you all, everybody, and good night. Thank you.
Good night.
Good night.
Thank you very much. Thank you. Thank you. Thank you.